physicals with patients, it's not like your standard physical. It's more of a nutritional physical. So I'm looking for a lot of things. First things first is patients will complete a long questionnaire with me. That's part of their comprehensive physical when they're becoming a practice member. In the comprehensive physical, I'm reviewing this long questionnaire. So in science, we look at subjective, what the patient tells us. Then we have a hypothesis, which is just our opinion. We use an objective analysis, a tool outside of me, outside of you, like a lab or a diagnostic, to be able to measure our hypothesis. We assess all three, and then we create a plan. When we're dealing with subjective, meaning how the person thinks or feels about themselves, it's really difficult to be able to measure that. And so we utilize a tool to be able to measure subjective data. And that subjective data, meaning all the feelings and thoughts and signs and symptoms and previous diagnosis, they put into the software. And then what it does is it spits out a medical symptom questionnaire number. That medical symptom questionnaire number I use to track the subjective data, meaning how a person feels in between lab draws. Because typically in a healthy patient, I'm only going to draw their labs every 6 months. So that medical symptom questionnaire score, known as an MSQ number, is going to help me track and monitor. The other thing that we look at is function. That's the biggest distinction between an allopathic doctor and a naturopathic or functional doctor. Allopaths, they'll tend to look more at the anatomy, the structures of the system. They do a little bit of physiology, but we're more focused on the function of the body. Allopathic doctors believe that you can diagnose something and then you treat the diagnosis, where we believe that the body can heal itself if it's given the right environment. So what we want to do is we want to create the environment that's conducive for healing. So we look at the overall function. So another thing what the report gives us is it gives us understanding and information based off all your signs and symptoms, what organ functions are not improving. So it'll look at, let's say, your immune system, how that's functioning. It'll look at your musculoskeletal system, your assimilation, detoxification. It looks at all these various symptoms of the body and aggregates that data, meaning it, and compiles it and puts it into a format that we can then interpret and use that scientific data. The other thing that it looks at is your timeline. So that helps us to more effectively find causative. Naturopathic doctors like me, we're trained to look for and identify the root causes, but sometimes that can be a needle in the haystack. So what the timeline does is it allows me to look at antecedents, which is the genetic predispositions, what you come into this life with, meaning, and genetics only accounts for less than 30%. The rest is environmentally driven. I'm trained in genetics and methyl genetics, so we do all that testing to be able to determine, but it also lets us see what triggers. So let's say I have a patient the other day, she's had multiple infections, she has cystic acne, she has all kinds of different mental as well as emotional imbalances, and a lot of it was triggered. Her parents were smokers, she got mono when she was young. So all of these, implications can impact, meaning that being around smokers, you're always getting that, fumes, the toxins, the chemicals, and then mono is a very difficult virus, Epstein-Barr, and it weighs the whole immune system down. And so then toxins like heavy metals and chemicals will tend to wrap around the virus within the system. And so as it continues to go, the body just gets weaker and weaker and weaker, and organ function goes down, and then boom, the person develops a disease process. We want to stop that before it even occurs. We want to make sure that the body doesn't develop that disease. We want to improve function so that the body accesses its natural ability to heal itself. And so we utilize that tool in our physical. The other thing that we do is body composition. So we put our patients on the InBody 570 to assess their visceral fat, their total body water to see if they're dehydrated, also their inflammation. We look at their visceral fat, metabolic rate, their lean muscle mass. So we're really assessing not just their weight, but their overall health. We also look at their blood pressure. We also have a stethoscope where we read the EKG, ECG. We see if they have any heart murmurs or AFib, because a lot of people, unfortunately, are not going to the doctor because they fundamentally, unfortunately, don't trust doctors. And so we want to be able to catch these things and then be able to refer to a cardiologist to be able to look, or we want to be able to see if there's risk for insulin resistance or obesity. We want to be able to really assess the patient as quickly and as effectively as possible, and that's why we do the comprehensive physical.